leukemia 白血病, gum bleeding for over 3 years. Diagnosed as leukemia 白血病, Western medicine treatment was ineffective. Current symptoms include recurrent gum bleeding, spitting out large amounts of 血, requiring blood transfusion in severe cases. The patient was thin, 人瘦. The tongue color 舌头颜色 was light red, then 红色. The tongue coating 舌苔 was like a thick layer of mud, and the color was white, 白色. The tongue tip had 瘀点, static blood spots. The right side of the tongue had 瘀点, and the sublingual area had 大片瘀斑, large patches of static blood and 瘀点. The pulse, 脉搏, on the left hand was chen and weak, chen ruo, while the pulse on the right hand was xián, string-like, hua, slippery, and forceful, 弦滑有力. The physician prescribed a formula based on Chái龙骨牡蠣汤, bupleurum root, Chái 60 grams, Pinellia rhizome, fa ban xia, 60 grams, Scutellaria root, huangqin, 20 grams, fresh ginger, shengzheng, sliced, 50 grams, jujube fruit, dazao, torn open, 6 pieces, Cotinopsis root, dangshen, 20 grams, cinnamon bark, rogue wei, 20 grams, Phoria, fuling, 20 grams, raw longbone, sheng longgu, wrapped in cloth, 20 grams, raw oyster shell, sheng muli, wrapped in cloth, 20 grams, raw rhubarb root, sheng da huang, 20 grams, and hematite, dai jia shu, wrapped in cloth, 20 grams, and processed aconite slice, bai fu pian, 15 grams. This was 1 day's dosage, and the physician prescribed 2 days of medicine. Decoction method: mix the herbs and decoct the soup, boil for 30 minutes after the water boils, take the soup, consuming half a papal cup's volume 3 times a day. The patient's bleeding significantly reduced after taking the medicine. Second consultation, urgen. The physician believed the formula was correct, but the dosage, zhongling, of the herbs was insufficient. Prescription, bupleurum root, Chái 125 grams, Pinellia rhizome, fa ben xia, 100 grams, Scutellaria root, huangqin, 45 grams, fresh ginger, shengzheng, sliced, 100 grams, jujube fruit, dazao, torn open, 12 pieces, Cotinopsis root, dangshen, 45 grams, cinnamon bark, rogue wei, 45 grams, Phoria, fuling, 45 grams, raw longbone, sheng longgu, wrapped in cloth, 45 grams, raw oyster shell, sheng muli, wrapped in cloth, 45 grams, raw rhubarb root, sheng da huang, 30 grams, and processed aconite slice, bai fu pian, 15 grams. After taking the medicine, the patient's bleeding stopped and there was no more spitting of 血 from the mouth. The patient stated, "This is the most effective prescription I have had in the 3 years since I became ill." The patient proactively requested 3 more days of medicine for consolidation. Doctor's analysis. In the Shanghan Luan, the original description of Chái long gu muli tong is Shanghan 8 or 9 days, which corresponds to this patient's 3-year chronic course. The essence of the illness is obstruction and phlegm-dampness in the qi pathways, water pathways, and shui pathways. Earlier treatments assumed leukemia meant shui deficiency, so many blood-toning herbs were used, which further obstructed shui movement, large sublingual stasis patches, stasis spots, and worsened phlegm-dampness. This was incorrect treatment. Chái luan gu muli tong acts as the body's cleanup crew, unblocking the qi pathways, water pathways, and shui pathways, helping the body transport and clear waste. For this patient, unblocking is more important than supplementation. Note: 1. Chái Long Gu Mu Li Tong is the name of an ancient classical herbal prescription. 2. Qi is a term in traditional Chinese medicine referring to a highly vital, constantly moving microscopic substance within the body, including the breath. Qi promotes and stimulates various physiological activities of the human body, including metabolism. The cessation of qi movement signifies the end of life. Some substances in the body are certainly present but invisible, and some exist only while the body is alive, such as the qi of breathing. 3. Shui is produced from extremely refined substances after being transformed by qi. It is responsible for nourishing and moistening the entire body, and it is also the material foundation for our mental and thought activities. Shui is different from the word blood. 4. Shang Han Luan is a clinical medical treatise authored by Zhang Zhongjing during the Han Dynasty and is the earliest existing systematic clinical medical work in Chinese medical history.